do it. Okay, we've got Representative Robert Johnson with us now. Thanks for joining us, Representative Johnson.
Sure. Glad to be here.
Yes, sir. So thought we'd get you on to give us an update from the legislature. You guys have been in session now for essentially a month. What do you think so far?
Well, the caveat is this is an election year. So everything is smoke and mirrors. Everything looks good, may not be good. Everything looks like it passed, may not. So, everybody's jockeying, and now that the qualifying deadline has passed, we're getting down to serious business. So we are, $3.9 billion to the good. So we have enough money to fix some problems. And so I think when we get closer to the Appropriations and Ways and Means deadline, where the money really makes a difference, we'll see more action.
I got you. What are your thoughts about one of these most controversial bills that would extend the Capitol Complex Improvement District, the CCID, all the way up to County Line Road, where Hinds County and Madison County intersect north of Jackson, 6 miles or so north of the state capitol in the heart of Jackson? What do you think about that legislation?
Well, this is our capital city, and I've said for a number of years that the biggest strain on the infrastructure in the capital city is state government. And I mean that we have more than 20,000 employees working downtown, all of whom don't live in Hinds County. But all these big office buildings, the biggest ones, the most downtown, are all state-owned buildings. That doesn't add anything to your ad valorem tax, so it doesn't really give you a real tax base. But it's a lot of people, a lot of stress on your water and your sewer systems that are already ancient as it is. So I don't have a problem with the extension of it. I just have my concern is that we spend the resources on the things that need to be worked on. And that liability has been reduced some because the federal government is sending over $700 million down here to work on the water system. And we could spend some of that money in the capital improvement district working on things that we don't get that money for already. So I don't have a problem with the size of it. I would like to see us focus on infrastructure issues that need to be fixed in our capital city.
Well, given that the city is set to receive such a huge sum of money from the federal government, it seems to address the financial aspect of this.
Well, let me interrupt you just for a second. Now, that only deals with the water delivery of water system. We still have sewage and drainage issues, and we have road and bridge issues.
Right.
And so that's what I'm thinking about. So that's why I said at least part of the problem has been addressed with those funds, and we can work on what we can do. Look, it just defines an area that the state essentially, the concept originally was the state will be a partner with the city in working on this capital city infrastructure and their issues. And some of that also, which we've already started working on, includes crime protection, extending a more extensive police force that we call the Capitol Police. Instead of giving the money to Jackson, we just increased the number of people we have working for the Capitol Police, and their jurisdiction will be extended, and in partnership with the City of Jackson Police Department.
Right, which I would suggest Representative Johnson is probably the main driver of this effort, is to address the crime situation in the capital city, and this seems to be an efficient way of doing that. I think the question is, should the state be in the business of essentially running that part, that's such a big part of a city, of a municipality?
Well, they're not running it. They simply have additional law enforcement. The state can control how much additional law enforcement. Nobody's suggesting you don't have to have Capitol Police going all the way out to County Line Road. That they could say we're going to concentrate our efforts around the Capitol in partnership with the City of Jackson. Your police force goes further out, but we'll take care of this area closer to the Capitol where state offices and state legislators, the governor, and all these people are. And that gives you some relief to take your officers further out. But right where we do business, where we invite guests in from out of state and from all over the world to come and do business with the state of Mississippi. We're going to help you make that more secure. And and the other thing it does too is that if the state partners with the city and work on the infrastructure and those things, then you make it a more inviting place for more businesses. We won't lose as many. I say the city won't lose as many anchor stores. You may have more businesses wanting to locate in the city of Jackson. But if I were a business, I wouldn't want to locate in an area where I don't know if I'm going to have water today or tomorrow. So all those things inure to the benefit of creating a more welcoming environment in a place where the seat of government for the state of Mississippi resides.
Right. I guess I misunderstood Representative Bain. My understanding from interviewing him a couple of weeks ago is that one of the primary purposes of this legislation was to extend the patrol coverage, the police coverage of that area to the Capitol Police and relieve the city of Jackson from that function, where the city of Jackson could focus its resources on the other areas of the city, the boundaries of the city that aren't within that Capitol complex improvement district.
Well, that it's not written into the law. They have to do it that way. I was suggesting that may be what the Department of Public Safety decides they want to do. That may be what they tell the city of Jackson that they want to do. What I was suggesting is that while they share that jurisdiction, not limited to either one of those police forces, and if they could have an agreement that makes that does what I suggest, but they could do it any way they want to.
I got you.
What I suggest, in my opinion, makes more sense for the Capitol Police to concentrate on this downtown around the state office buildings area, and let the city of Jackson handle the more distant areas of the city.
I see. Well, I thought they were already doing that. I thought the Capitol Police were already patrolling that area. Are we talking about extending?
They are.
Okay.
They are, but they have come back. They have come this session and asked for an appropriation for more officers, more cars, more equipment, and so they're going to be a more extensive force. And I'm just suggesting that they figure out a way to work in cooperation with the city, whatever makes sense for the state capitol.
I see. Well, and then you make the point that the money coming from the federal government, which is a huge chunk of money, I don't know how they came up with that figure, because it seems like before the omnibus bill was passed, which included this $600 million, it was, and there's another $100 million through another program. There was really nothing definitive to indicate the financial need to address just the water delivery system. I never saw any reports to that effect.
I didn't see any reports either, but my understanding is that the EPA or whatever agency that came down and did an evaluation, and also what I think is a partner in a lawsuit against the city of Jackson about the delivery of the water and for its citizens. I think that they had a group of experts to come down and make an evaluation and come up with that number. That number did not come from the city of Jackson. It came from the third party people who came down and said, "Look, let me look at and I think in partnership with the State Department of Environmental Quality."
We got a break right here. You joined us late. Can you hang around and into the next segment?
I got another 10 minutes.
Okay. We'll get it knocked out. Coming right back with Representative Robert Johnson. Stay with us. We've got Representative Robert Johnson on the show with us. I'm respectful of your time, Representative. I know you got to be gone in about 5 minutes or so appreciate you hanging on through the break.
No problem.
Yes, sir. Thank you for your insight on the CCID bill that, as you know, has been met with a fair amount of resistance from the city leadership, and there have been some protesters as well that have been around the Capitol that are showing their disapproval of the bill, but we shall see where it goes. I think on the one hand, folks see that the city is got a significant crime problem, of course an infrastructure problem as well, and you could argue the two are somewhat related. It's just, to me, it's a question of, does it make sense for the state government to extend its authority and be, I think, still to a greater extent involved in the operations of the city of Jackson? And
I think you make a valid point. It's this idea of we've been faced with the last 2 or 3 years One time during the session, we could only use restrooms on the first floor, and people have had cars broken into close to the Capitol. That doesn't make any sense. Things that you don't want to have happen in your Capitol. So what do? You could just say, look, you all are short on funds. The tax base is left. We were downtown. We really are not contributing. We could give you the money. Then some people say, look, they got their own problems, with the chaos, the way, the administration is operating. Maybe that partnership ought to be one where we have more input. And so that's how the Capitol complex idea evolved.
Yeah.
But what I will admit to you, and I think one point you make is great. How do we contribute? How do we do it? Is there a way short of getting that involved in the administration or the running of the city? There is a way, and I think that's why I would urge the leadership in this state, take your time. You're not going to fix the problems in Jackson overnight, and you're not going to solve them all by just walking in here and taking over the city of Jackson. I mean, we don't have a stellar reputation in terms of running state agencies. We got $95 million we can't find.
Right.
The Department of Human Services has mismanaged and left. That's a state agency. That's something we have some authority over, and we're not doing anything about that. So I think you make a good point. We need to be very careful about how involved. I mean, do you want to take that responsibility and put it on the taxpayers of the whole state, and not knowing what without really any proper planning?
Right.
I think that's a great point. So hopefully we'll take more time.
Yeah, and it should be, I think, thoroughly debated, and hopefully there'll be some thought put into that process before the trigger is pulled there. While we got you, let's talk about health care in the state of Mississippi, which is certainly reaching a critical point. We've got rural hospitals and frankly, large urban hospitals as well that are struggling financially. What do you think we ought to do, and what are the chances of getting anything done?
Well, we need to do something. We need to take whatever funds. If there's a service that I think government needs to have at least some responsibility for, and that is providing at least access to health care for its citizens. And so, just as a short background, so when people talk about why these hospitals are suffering, what has happened before the concept of the Affordable Care Act or expanded Medicaid Act came out, one of the big issues was the cost of health care. And one of the things driving high cost of health care in a state like the state of Mississippi is that we had a lot of people who didn't have health coverage, didn't have doctors. They get sick, they show up at an emergency room. And so hospitals had to take care of them. But that cost the hospitals didn't have to absorb before the Affordable Care Act. Well, what happened was that was uncompensated care that the federal government would send that money. You just say, this is how many people I treated who didn't have any coverage. And you said, if I'm a public hospital, I need to treat them. The doctors have to treat them. This is what we are owed, and they would be reimbursed for that uncompensated care. But that was that's high dollar health care. It would be better if people went to a doctor and managed their care. Instead of having a diabetic event or having a heart attack, they would be taking medicine to prevent that. And so the idea of expanding Medicaid or providing coverage is that, look, that cost will go down, but what you should do is get the proper health care, and you do that by being covered. That means that you can't go to the emergency room now to get health care. You got to go to a doctor. But the problem is we don't have that money anymore. We were taking it before. Now we're saying we don't want it. The uncompensated care, disproportionate payments, all that covered all the loss that hospitals and doctors had to absorb because the federal government said, hey, we want you to see these people, we want to keep them healthy, and if they don't have a doctor, if you see them, we will compensate you for it. And so that's not happening now. And people get all wrapped up in the idea, we're expanding Medicaid, it's going to cost too much. We were taking the money 7-8 years ago. It's the same money. All it's saying is that instead of having catastrophic coverage on care, we want you to do preventive care. Get coverage, go to your doctor, and get that done. So what do? Why don't we just take the $1 billion a year that they're giving us to provide coverage for working people? And I'm glad you brought up some, Gerard. A lot of people they talk about rural hospitals. If you go to the hospital in Baptist, I had relatives go to Baptist or St. Dominic, and you wonder, why is it now that a nurse only comes by every 5 or 6 hours as opposed to every hour? Because these hospitals, these great hospitals that we have, and they are great, instead of 8 nurses a floor, they got 2 nurses a floor. Instead of 5 doctors, they got 1. Because these people, the hospitals don't have the money they were getting from that coverage that we had, that we were taking. They don't have that money anymore. So we just need to settle down. Our Medicaid budget is $6 billion. This is as big as our state budget. People go, oh my goodness, that's too much. Well, 90% of that is federal funds because we want people to be healthy. And so we won't be doing anything different. We'll just be taking care of those hospitals and those working people. Not these people work. The people who don't work already got covered. But these are working people. If we did that, it wouldn't cost us anything. The state economists say it would create 10,000 new jobs. It would create healthcare infrastructure that we need in all these places. It would be an economic boom for the state. Well, boom in the long term, but at least a balance and economic growth in healthcare in the short term. So that's all we need to do. That's the first thing we need to do, and stop bleeding our hospitals. That the Hill-Burton Act back in 1968, the United States said we had to have, because they said even rural people who are not very rich or don't have a lot of money, even they deserve to have a hospital, an emergency room in that county.
So I appreciate that, Robert. And so you've made, I think, what is the standard case that we hear from proponents of Medicaid expansion. And on the surface, your arguments certainly are compelling. What is the reason you believe, sir, that opponents don't let this bill get through? We will have, 15 bills this year, all of which were defeated.
It's just politics. Let me tell you something, Gerard. Sometimes I'm embarrassed to say that, but now I'm not anymore. I've been in the legislature 30 years, and there were Republicans and Democrats here when I got here. And you know what? It didn't matter. But people were conservative or they were liberal, but they didn't. The label didn't define what they would do. People, you had rural legislators or urban legislators who were in a minority,
right?
But people had common interests, and we passed legislation based on that interest, not based on party. I continue to say what a national Democrat and what a national Republican is not what a Mississippi Democrat or a Mississippi Republican is. We don't have to comport to whatever agenda that those different national agendas are. We need to make our legislation, our politics local. We need to do what's best for the people here in this state. And if we would put that aside, there's room on both sides to sit down and say, hey, I am not completely right, neither are you, and let's see what we can do. What I need in Adams County is probably the same thing you need in Newton County, but it's probably not the same thing they need in Madison County or Rankin County or Hinds County. But let's see what we can put our heads together and get done that way. That's how I learned how to legislate, and we don't do that anymore.
Yeah, and I certainly agree with that. That I think that applies to what appears to be at all levels of government, where the respective sides just kind of hunker down in their corners, and there's very little alignment on anything. And it seems like the compromise has become really a dirty word in politics. There's just no willingness whatsoever or interest in compromising. I have some thoughts. We're out of time, and I know you got to go. I have some thoughts as well, really for both sides that I've expressed on the program with respect to their respective arguments for and against Medicaid expansion. And you recall you and I first met. It was 2013. We were down at Mississippi Public Television, and I was doing a split-screen debate on Medicaid expansion in opposition of it, and was providing some ideas of how else to address this problem. And we just got to keep talking about it because the problem's not going to go away, as you well know. But I appreciate you coming on, sir. I know you got to get going, and thanks for staying with us.
Thank you for having me.
Yes, sir. Representative Robert Johnson has been our guest here on Middays. We'll take a break. Coming right